for. Now, I'm just going to talk a little bit about safe supply and the pilots that have been happening. In Ottawa, it's had a significant increase, and this claim that people don't actually use their safe supply, they just sell it to others. This is a quote from the former Stephen Harper legal advisor, Professor Ben Perrin, that the facts, he states, participants in the Ottawa Safer Supply program reduced their use of illicit fentanyl by 85% while on the program. We've seen great results at Parkdale Queen West in London. Dr. Sereda has been running a really important program. And, we know that safer supply reduces risk of death and overdose, reduces reliance on an unregulated supply of drugs, increases access to engagement with health and social services, improves social well-being and stability, reduces ER visits and hospitalizations, improves physical and mental health, and reduces healthcare costs. That is a fact, Mr. Speaker, and also criminal activity. That's in the facts from these studies, Mr. Speaker. And it certainly helps people gain their life back. And we've heard, some people speak, participants, about what Safe Supply's done. One person wrote, "My whole lifestyle improved. I got my life back. My life has improved drastically. It saved my life. I function productively in society. My life is getting better. Free times to do more constructive things. More energy and confidence to focus on my art. Open a whole new outlook and positive way of thinking." The list is long, Mr. Speaker. But what I do know is that what we're doing isn't working. We're seeing a government take a very, very weak approach in responding to a health crisis, which is, shows the stigma underlying by the lack of investments and the lack of urgency, Mr. Speaker. This is the stigma right there with the government and their failed approach, and also their inability to pull together all parties in this crisis. So one thing I'll understand with the Conservatives and what they're bringing forward is frustration. Canadians are frustrated. They're frustrated by the lack of action by this government to respond to this crisis. But it doesn't mean the response should be guided by misinformation. It doesn't mean we cut off safe supply as a tool to keep people alive, to ensure that people are able to get the help they need and find a pathway to recovery, to treatment. But this motion today to gut the harm reduction program, to stop safe supply in its tracks without proper evidence and science, with going against what the Conservatives deem as the activists, the police, chief medical health officers, coroners, moms, experts, the expert task force on substance use, doesn't make sense, Madam Speaker. I see you've changed. And my time's wound up. But Madam Speaker, I hope this dialogue, I hope this conversation, that we could turn it around and try to come together and find some common ground to deal with this crisis that's right before us, that's impacting everybody here.